We have a wonderful presenter that's joining us from Bluebird Bio. Her name is Sheri Reed, and she has the floor.
Thank you. Thank you so much. Good morning there. I'm also coming from the East Coast, so it's good afternoon to me, but good morning to all of you there in San Francisco in the Bay Area. So thrilled to be with you today. And just to echo Antoine's words, we're going to be talking about Lyfgenia, which is a gene therapy for sickle cell disease. And, we're going to make this a conversation. So I'm going to pause throughout after a few slides or whatever and open the floor for questions because, I understand these therapies are new and it's pretty dense material. And it's really something that, you want to absorb and take your time with, and you may need to hear a few times. So, again, let's make this a conversation. Feel free to ask questions, whether it be when I stop periodically, or if you need to save it all to the end, or if you want to put it in the chat. Either way works best for me. It works well for me. So again, thank you for having me today. Going on with the presentation, a few disclosures and disclaimers. I want to thank Sickle Cell Anemia Awareness of San Francisco for having us here. And then I do need to disclose that I'm an employee and currently a shareholder of Bluebird Bio. Okay, so a little bit about me. I'm part of the team that's called the Patient and Community Education Team. I know it was advertised that my colleague Etzel Betzer was going to be here today. And unfortunately, Etzel has left the nest. But Etzel and I were great colleagues and shared the same role where he covered the West, I covered the Northeast. So my background has been, I've had 2 decades of experience in pharmaceutical sales and training, and then over a decade of experience working with bleeding disorders, specifically hemophilia, in specialty pharmacy, doing patient advocacy and sales for them. One of the things that I think is I'm passionate about is really educating or helping to educate and provide information to people from Black and Brown communities about healthcare and healthcare treatments. So again, I am so honored to be here with you all today and share this information. And as I said, I'm from back east, so I live in the Philadelphia area. So a little bit about Bluebird Bio, because you're probably wondering, who is Bluebird Bio? Has anyone heard of Bluebird Bio? Just, if you can get to your
Yeah.
raise your hands, just there you go. Thank you. Dianair, is it? Dianair's heard of Bluebird Bio. Great.
It's Deanna, but everybody call me Miss D.
Thank you, Miss D. Deanna. Thank you. All right. So glad to hear that you've heard of Bluebird Bio, but let's tell everyone else who Bluebird Bio is. So Bluebird Bio is a biotech company, and they've been dedicated to developing gene therapies for severe genetic diseases. Two things to know about Bluebird Bio. We've been leaders in gene therapy research. We've had over 10 years of research in gene therapy specifically, with over 180 patients who've been treated with our therapies in clinical trials. And that has led to 3 FDA approved, which means 3 therapies that are on the market for gene therapy. One is for a disorder called CALD, which is a neuromuscular disorder affecting young boys. The second one is for transfusion-dependent beta thalassemia. And the third, of course, is for sickle cell. The other thing you should know about Bluebird Bio is they definitely have a commitment to patient access. And the ways in which we carry that out is we have a patient navigation team called My Bluebird Support. This is a team of 3 individuals who can help patients like yourselves who might be contemplating this therapy, help them navigate all the steps of the treatment journey. And we're going to talk about that team a little later. Lastly, I'll say our team has been engaged with payers, those payers being Medicare, Medicaid, and commercial payers for several years, understanding that these therapies are new. There's a lot of new policies and processes that need to come out about access for these therapies. So we've been engaged with these payers. And again, that's really to address barriers to any access. So, you're going to see our team is really there to support patients on this journey in multiple ways. Any questions before we dive into Lyfgenia, what I presented so far? Okay, so let's talk about Lyfgenia. So as I mentioned, Lyfgenia is a one-time gene therapy that is used to treat sickle cell disease, right? So here's what's unique about Lyfgenia. It's made specifically for you. We're using your own stem cells. That means you don't need a donor. There's no match donor that's needed. You are your own donor for this therapy. It's indicated for patients who are 12 years of age or older who have a history of vaso-occlusive events. Now, I'm going to pause there for a second. Raise your hand if you've ever heard the term VOEs or vaso-occlusive events. Miss Nadina has heard it. Okay. Okay. Miss D has heard it as well. Yeah. Great. Oh, great.
Antoine, you have too. Occlusive, I can't even say it, but there you go.
Crisis.
There you go. Thank you. I love it that you just broke it down, made it very simple.
Crisis. That's it.
There you go. So, vaso-occlusive events is a clinical term, and it really is an umbrella term that encapsulates all the types of crises that a lot of sickle cell patients have. So you're going to see throughout this presentation, I'm going to talk about VOEs and VOEs, and just as long as you all understand what I mean by VOEs, I think we're going to be just fine. So I just want to make sure of that. But lastly, how Lyfgenia works is it's going to add functional or working copies of your beta globin gene to your cells, and that in turn is going to lead to what we call an anti-sickling hemoglobin that may decrease or stop the VOEs or pain crises, as many of you have categorized them. Any questions there about what Lyfgenia is and how it works? All right, we're going to keep going. So there's some important safety information that I do need to share with you. This is also required by the FDA. So the first thing is that at the time of our initial approval, which our approval was December 8th of 2023, we had 3 patients in our clinical trial that were diagnosed with blood cancer. Now, 2 of these patients were treated with an earlier version of Lyfgenia where we use a different manufacturer in a cell transplant process. And the third one had what we call alpha thalassemia trait, or a dual alpha. So because of this, you should know that treatment with Lyfgenia, it could increase your risk of blood cancer. Because of this, you want to be evaluated or monitored at least every 6 months or for a minimum of 15 years after receiving Lyfgenia. As always, you should talk to your doctor about the benefits and risks of Lyfgenia for you and about your treatment options. I will also say that if you are evaluated to have risk factors that could increase your chances of developing blood cancer, you want to be aware of some of the signs and symptoms of blood cancer. So if you look there on the right, that list starting with abnormal bruising or bleeding, severe headache, swollen glands, these are all potential signs and symptoms, but not exhaustive of all the signs and symptoms of blood cancer. But if you were to notice this, you and your caregiver and your healthcare provider should, be evaluated by your healthcare provider. And if you're diagnosed with the cancer, have your treating physician contact Bluebird Bio and let them know. Lastly, you may experience some side effects that are associated with some of the medications that are included in a part of the treatment of Lyfgenia, and that's including chemotherapy. And you should be aware that after receiving chemotherapy, it may not be possible for you to become pregnant or father a child. So because of that, you definitely want to discuss your options for fertility preservation with your doctor before treatment. Okay. And I do want to say we're going to talk a lot more about blood cancer and give some better context to that later on in the presentation. But right now, let's talk about how Lyfgenia works at the genetic level. So Lyfgenia is gene addition therapy. That means it's designed to add genetic materials to your cells. So the process, in short, is really you go in, your cells are collected, your cells are then sent to the lab and modified. Lyfgenia, once they're come back from the lab, Lyfgenia is infused into you, and then your body starts making this functional working adult hemoglobin. And then once your body starts producing this functional adult hemoglobin, we know that this can potentially decrease or stop the vaso-occlusive events that most sickle cell patients have. Let's take a look in detail at the study of Lyfgenia and how it was studied. So Lyfgenia is currently the longest studied approved gene therapy for sickle cell disease. And you should know that the safety of Lyfgenia was studied in a clinical trial that we refer to as Study 1. And it's also being studied in a long-term follow-up study. So some of the clinical trial data that you should be familiar with is there were 54 people who initiated stem cell collection. The median age of those patients was 25 years of age. Now, the youngest was 12, the oldest was 43. And the median follow-up duration was about 42 months in this trial at the time of this publication here. So again, I've mentioned it before, I'm going to say this again, and we're going to talk about it even later, but the protocol for Study 1 of Lyfgenia did evolve over the process, over time, and that meant that there were changes and improvements in our cell collection, our transplant, and the manufacturing process. And you may say, well, what does that mean? We're going to talk about that a little further down the road to kind of give some context to you about that. But in short, what that means is the Lyfgenia that patients are receiving on the market today that is FDA approved was the one that had, obviously all the improvements in the cell collection, transplant, and manufacturing process. So it's a different in those processes than anyone who may have been early on in the study.
Hey, Sheri.
Yes.
I had a question for you.
Absolutely.
When you talk about the 54 people initiated and then the 25 years old being the median age,
Yes.
do you have a number of those that were towards the latter portion of the latter age of this mean so that we have an idea?
Gotcha. A breakdown. I don't, but I can certainly see if I can get back to you with that data in terms of like the actual breakdown of how many people were 12 or 13 or 15 or 42 or whatever.
Gotcha.
What
Okay.
I will add to that in context is that even though the oldest person in the trial was 43, there is no age limit to Lyfgenia that is on the market today. So I know in giving this presentation, a lot of warriors hear that range of over 12 or youngest being 12 and oldest being 43, and they think, oh, well, I'm 45, this isn't for me. That's not exactly true. This is a treatment that you definitely want to get evaluated with by your clinician, and it really does depend on each individual person's individual health situation. So again, there's no requirement that you can't be over the age of 43 and receive this therapy currently. Did that answer your question? Okay, great. Any other questions? You're welcome. Any other questions before I move on? I'm going to continue on with the study data, but any questions to this point?
Just for purposes for people who aren't known to always aware, what's when we're talking about the duration of follow-up, normally what is the median for that normally when testing like this happens so that people understand from a scientific perspective why you guys do the 42 months opposed to longer stages or lesser stages?
Yeah, that's a great question. I don't know. I personally don't know if there's a limit, a minimum required follow-up that's required. Well, let me say it this way. You're going to see when I go on further and presenting the study data is that after receiving Lyfgenia, patients were evaluated for six to 18 months after the treatment. And so when we say the median duration of follow-up was 42 months, if you can imagine, this trial was going on for a number of years. So somebody who started let's just say the trial started in 2015. Someone that started in 2015, and then by the time we got to market, or by the time we presented the data to the FDA, we cut the data was cut off at 2021. That person theoretically had 6 years or even longer in the trial. So the median, meaning the mid-range point that anyone in the trial was followed up, was 42 months.
Got it.
So
Okay.
I hope that kind of helps clarify that. I mean, you've got some people who may have only had been followed up, and their data is included, that were somewhere between 6 and 18 months. And then you have others who may have started the trial earlier, and then, therefore they may have been right along that 42 months. But the median, the average right in the middle of the follow-up for all the patients was 42 months. And that's at the time of this data. There is new data that has since come out with longer median duration follow-up. Okay.
Thank you.
You're welcome. Let's move forward. So let's take a look at the efficacy of Lyfgenia. So as I said before, Lyfgenia is a one-time transformational therapy. I want to emphasize one time because people have asked the question, well, do I have to get it again? We don't know that yet, right? Right now, the process is one time. That's why there's long-term data that's ongoing. But it is a one-time treatment, and again, with the potential to decrease and stop vaso-occlusive events. So taking a look at the trial, the efficacy data in the trial, there were 36 individuals in the trial. 32 of them were evaluated for the number of VOEs that they experienced between 6 and 18 months after treatment. And here's what we found. 88% of that 32 didn't experience any VOEs after treatment, and 94% did not experience any severe VOEs. And as it says there in the box, you had 4 individuals who didn't experience any vaso-occlusive events between 6 and 18 months after treatment, but they did later experience a vaso-occlusive events afterwards. The other thing you should take away from this slide here is that, whether a person was 12 and in the range of adolescence, or over 21 or 18 in the range of adult, there was no difference in efficacy or safety that was observed between either of those age groups. Let's take a look at this data visually in another way. So if you take a look at this graph here, this chart, on the left-hand side, you're looking at 24 months prior to the enrollment into Lyfgenia, or into the trial. Each horizontal line represents a patient, and you're going to see open white circles and grayed in circles. And each of those circles along each patient represents a vaso-occlusive event. So you can see that many of these patients experience a vaso-occlusive event almost every month, or even more so over the course of 24 months. Right there in the center, you see the green line. That demarks the point at which patients receive Lyfgenia infusion. And then everything to the right is looking at 6 to 18 months after Lyfgenia infusion. And you can see it really represents, the 88% that didn't experience a VOE and the 94% that didn't experience a severe VOE after Lyfgenia infusion. Now, just to add some context on how are we defining VOE versus severe VOE. So in the trial, a VOE was an episode of acute pain caused by nothing other than a vaso-occlusion that lasted more than 2 hours, and that could be an example. That could be acute chest syndrome, or blood trapped in the liver, or blood trapped in the spleen. Severe VOE was defined as requiring a hospitalization or even multiple visits to an ER urgent care for over 72 hours, and of course, while they're receiving IV medications at each visit, or episode of priapism requiring any level of medical attention. So that's the difference, or to differentiate how we define VOE and severe VOE in the trial.
Sheri, we have a question from DNR.
Go ahead.
Hey, Ms. Sheri, I just wanted to ask, with the patients that entered the trial, was there do you have any information on whether they were SC sickle cell patients or SS sickle cell patients,
Yeah,
or
great
how does
question.
that work?
Appreciate that question. Love it. So when the trial opened up, we were accepting all genotypes, SS, SC, whatever. I will tell you that the 54 that went to 45, that went to 30, these numbers changed throughout. You're going to see that a little later. But the 36 individuals that were eventually evaluated in the trial, they were all SS genotype. Again, there is no requirement that you have to be SS genotype in order to receive Lyfgenia. Our label is open to different genotypes. But again, that is going to be a decision. That decision is actually going to be twofold. Number one, it's going to be a decision between you and your healthcare provider that would be administering the treatment if you were someone who was not SS. And then number two, I will tell you that some states, or not just states, but some payers, whether it's Medicaid, commercial, or otherwise, they may follow or require there to have been some trial data that represents something other than an SS patient. And since there isn't any, they might say, well, we're only going to approve this for SS. But again, those are all great questions and things that you want to, talk with your healthcare provider about. But also, this is where our patient navigation team that I'm going to talk about a little later will be able to help you navigate that as well.
I had
Okay,
a
thank
question.
you. So
Yep.
all
I had
the
a question.
I'm sorry.
Curious to know. I'm not sure if this actually is something you can answer or not. I'm curious to understand if there is any data for the clients to understand how often certain patients that were a part of the data collection, what medical provider they had that allowed them this. I'm guessing the way I'm looking at it is just helping people. How do I say this? Uh, when you go buy something and it's a certain price, but then you price match it with other places because you want to make sure that you are getting the right deal. The
Right.
same way that I would look at is if I have Medicaid and somebody else has something else, and if I'm in a position where my care provider might have questions, sometimes those folks would like to have the data that advises them a comparison of folks in the same region or in other regions that are getting this to help push along their opportunity to get this. I'm just curious to know if you guys get the data of which medical providers are more apt to giving this opportunity for their
Oh,
clients opposed to others. Or is
yes.
that too much?
No, no, not at all. Now, I'll tell you the specifics of that. That's where you're going to want to tap into our patient navigation team. But we have not only the patient navigation team, but national account execs, and they work state by state, commercial plan by commercial plan. They work right alongside the treatment centers that are administering this with each individual patient and their plan to help navigate approval for the therapy. So, I mean, when we talk about Medicaid, that's going to be state to state, right?
Mhm.
Um, Commercial plans can be nationwide or regional or whatever have you. So,
Sure.
but all of those specifics that we have a team that can help sort all that out and help you navigate that. I want to make sure I answered your question because I feel like you
Yeah,
started one.
that's great. Just because
Okay.
we go through some of these presentations where, in some respects, some people are going to give us stories later on saying, "Hey, I'm with these, and they just don't let me do that at all." But
Ah,
I don't realize who else in other areas are possibly getting the opportunity opposed to me. And they always
yeah.
want to have the opportunity to compare their situation to others so that they can have more bullets in the chamber to fight for their opportunity.
Right. And the good news is we have a whole team that's going to be fighting for you. For, if you were to move forward and say, this is a therapy I want you and your provider, we've got a whole team that supports your provider and you to, to navigate all of that they're going
Cool.
to do the fight for you, so to speak, that lift for you in terms of that. So I can tell you across the board, this therapy has been out just over a year, and there are Medicaid plans that are paying for it. There are commercial plans that are paying for it. So access, reimbursement for access is really moving along really well. I think when we first got approved, one of the biggest challenges was that there weren't a lot of payer policies out there for gene therapy, not just in sickle cell, just gene therapy as a whole. So that is really moving along. And I can circle back with you in regards to where the state of California is in terms of some of the payer policies with gene therapy right now.
Yeah, that's really good to know, just because obviously everything is really about opportunity and hope. And the more hope that they can get, it's just going to feed their fire to, push forward to get that opportunity. So I thank you for that information for sure.
And
You are so welcome.
I
Go
just
ahead.
want to piggyback off of that in knowing that the system is recognizing the value of what your organization or your business is offering to clients is very, very important, because I think that's where we really fall short with regards to what is it going to cost me, or what does that mean with the coverage that I have, and all those other questions that come into play when new developments come about.
Yeah.
So, yeah, I think it's great. I just want to just, like I said, just say that. Thank you. That's wonderful.
No, you're so welcome. And these questions come up all the time. Gene therapy, I'll say, is not inexpensive, and again, across the board, it's not about penalizing sickle cell patients. It's just this therapy, whether for a sickle cell patient or a patient with some other rare genetic disease, these therapies are expensive. And so people hear the price tag and they think, well, why would they price it for that? But I think you really have to reframe. It's really more about access. We're fortunate enough that most people in this country do have access to healthcare, whether it be commercial, Medicaid, or Medicare. And the good news is, as I said earlier, that we have an entire team that has been engaged for years with these payers, and they are helping them kind of shape and create policies around the reimbursement for this. So on the commercial side of things, in other words, once this therapy has been approved which it has been, now that it has been approved in the commercial landscape, there is access that is happening all over the country. People
Fantastic.
are getting it.
I commend you.
Thank you. We're really proud of that. Any other questions before I move on? I have one more efficacy result that I want to share with you from the trial, and that's our neurological result. We had 5 individuals who had a history of stroke that were in the trial. Now, they were 18 years of age, and all of them were on chronic transfusion therapy prior to Lyfgenia. And what we found is that 44 to 60 months of follow-up, all 5 of these individuals remained transfusion independent without a repeated stroke. So more efficacy data for Lyfgenia. Now I want to really spend some time talking about the trial, and I think this visual is going to help, and this is going to help as we transition to talk about and give context around the blood cancer risk. So remember I said Lyfgenia was studied in what we call study 1, and we know that the protocol of Lyfgenia evolved throughout the study. When you look at study 1, there was 3 arms to that study, 1A, 1B, and 1C. And you can see there were 45 people treated across all of study 1. So we had 7 people in 1A, and then there was a protocol change that happened between 1A and 1B. And then you had 2 people in study 1B, and we had a different protocol change, another protocol change between B and C. And then we had 36 people in study 1C. So when we talk about the safety of Lyfgenia, we're talking about all the patients across all 3 study arms, A, B, and C, so all 45. When we talk about the efficacy of Lyfgenia, that's based on the arm 1C. And as I said earlier, the Lyfgenia that came to market and is FDA approved is the version that was used in 1C. So that was after the 2 protocol changes in cell collection and manufacturing process. Now that you have an understanding of this, let's talk about the blood cancer risk. So I said earlier, we had 2 patients that developed, or 3 patients actually, that developed blood cancer. Now, 2 of them were in study 1A. And remember, study 1A was the very early version of Lyfgenia. It had a different manufacturing process and transplant procedure. These patients developed what we call acute myeloid leukemia, and unfortunately, these patients did pass away during the clinical trial. And if you remember, we had another protocol change between study 1B and 1C. Now in study 1C, this 3rd individual that developed a type of blood cancer developed what we call MDS, or myelodysplastic syndrome. Now, this individual had a type of sickle cell called alpha thalassemia trait, which means they have a dual alpha globin gene deletion. So what we now know is that patients that have this type, this dual alpha globin deletion or more, that there is a limitation of use. So in other words, they're not a candidate for Lyfgenia because of that genotype. The other pieces of data that I wanted to share is that anytime a patient is going through a process that involves mobilization, conditioning, even infusion of Lyfgenia, this can have an effect on the blood system, and it can increase your risk of blood cancer. And then the last piece of information I wanted to share is that there is data that says that individuals who are living with sickle cell disease do have an increased risk of blood cancer as compared to individuals who do not have sickle cell disease. So again, I hope this puts some context around the risk of blood cancer, but because of the risk of this blood cancer, it's important for you to be monitored at least every 6 months for a minimum of 15 years after receiving Lyfgenia. Now, I know that's a lot of information right there, and I'm definitely going to pause and see what questions we might have.
Okay, so I have a question. So so you're saying without Lyfgenia, their risk is really high in getting blood cancer. Is that correct?
I don't want to say it's high. They have an increased risk compared to patients without sickle cell. So,
okay, because I have not heard that before. So this is really
yeah.
new information, and I'm not, I know we have clients on this in this session, and I'm just wondering if any of you all have heard of that or have been told that your risk are high with blood cancer.
And while we're waiting to see if anyone responds, I do want to add a little more context to that because, it's not. So let me just put it into a different context. The risk of blood cancer overall is very low in the general population. But if you were to segment out and say, well, what is the risk of blood cancer with patients who have sickle cell versus patients who don't have sickle cell? It is a little higher for sickle cell patients. But again, remember, the overall risk of blood cancer is generally low. So, it's not a lot of patients, but it is something to, ponder or consider when we're looking at this whole concept of better understanding the risk of blood cancer in the trial. I also want to just to clarify, when I talked about, anytime you have mobilization, the stress of mobilization and conditioning and infusion, like that's a very similar process. We're going to talk about what the process is of the treatment journey in the next slide, but that process is very similar to bone marrow transplant. So anytime you're going through what we call cell or gene transplant processes, you're going through mobilization, you're going through conditioning. And we know that this can increase any patient's risk of blood cancer.
Okay. That helps. That's great. Because my next question was going to be, so do you have any data or any numbers about, has any information been collected? And I guess maybe, I probably need to ask that to another organization about information about how many people living with sickle cell have somewhere along the way, along the lines, acquired a blood cancer. So,
Yeah.
yeah, okay,
There,
no worries.
what I can do is I want to drop in the chat Lyfgenia.com, which is our website for Lyfgenia. And there you can find our prescribing information.
Okay,
And there is in the references, just making sure, yep, there is a reference of a article or study that shares that information.
cool. Okay,
Uh,
great,
so
great,
that would
fantastic.
be a good source to obtain to look up at least.
Absolutely. It's a great start. So all of you, all of, yeah, clients, that's where they should start with those articles and that information
Yeah,
to, yeah,
there you
begin and be empowered with the necessary information. Okay.
go. Right.
I'm good. Thank you.
No, you're welcome. Great question. Any other questions? Because again, I know this is really dense material and I really tried to break this down as simple as I possibly could, but please don't hesitate if you have a question. All right. Well, let's move forward and let's talk about the steps of the treatment journey. So, my slides are, there we go. All right. So there's 6 steps to this treatment journey, and I say that with emphasis because, I've heard doctors say, patients come in and say, I heard about that gene therapy. I want to come in on Thursday, get my gene therapy so I can be, at back to school on Monday, and it doesn't quite work like that. So let's take a look at the steps. So the first step is pre-treatment. So before you're going to begin Lyfgenia, you're going to talk with your doctor. Obviously, there's even a step before this. You're going to talk with your doctor. Am I a candidate? They're going to evaluate you and so forth. Once that's determined, they're going to talk with you about all the medications that are going to be involved in the treatment process. And they're also going to talk with you about why blood transfusions are required and important. When you get to step 2, this is the stem cell collection process. So now this is going to take about a week you'll see there it says QTC. That stands for Qualified Treatment Center. That's what we call our treatment centers. These are centers usually at hospitals or teaching hospitals that are really adept in doing cell and gene transplantation. And they've been trained by our team in exactly how to manage in this process in totality. So while they're going to prep your stem cells for collection by, in other words, by mobilizing your stem cells. So pulling your stem cells from your bone marrow into your blood. That's the mobilization process. Once your stem cells have been mobilized, then they're going to collect them through a process called apheresis. The third day, that usually takes a day. Sometimes it may take 2 days for them to get the required number of cells. The third day, they're going to collect backup stem cells. And these are, in the event that, it's needed down the road, and they'll be collected and stored at your treatment center. It's possible this step could need to be repeated. It's going to be really important. The first thing they're going to identify is, did they make dose? Meaning, did they make the number of stem cells? Did they collect the number of stem cells that they need to move forward in the manufacturing process? After this whole process is done, like I said, about a week at the Qualified Treatment Center, you'll go home. You're going to be living your life. Your stem cells will be sent out to the lab, and this is where the Lyfgenia creation process takes place in step 3. Now, this takes on average 10 to 15 weeks. It could take a little longer, up to 22, but I think we've been averaging between 12 and 15 weeks. And this process is pretty rigorous, where your stem cells are going to be looked at. First of all, make sure that they've made dose, make sure that they're, quality stem cells for them to move forward the process. They're going to test for safety. A lot of safety testing is occurring while this is all going on. And while this is happening, you're back to your normal life, doing the things you love to do. Step 4, your treatment center is going to get a call and say, we're ready to ship your cells back. Great. They're going to call you, set up a date and time for you to come back in to begin the entire process of conditioning and chemotherapy. Once you come in for that conditioning and chemotherapy, keep in mind it's going to be 4 days of receiving or administering the chemotherapy, and then 2 days of recovery. Again, you're going to be checked in at the qualified treatment center for this entire week. And then after the 2 days of recovery, you move to step 5, where we're now ready to infuse Lyfgenia into you. So Lyfgenia comes in bags. It kind of looks like chemotherapy bags, and it could be anywhere from 1 to 4 bags. And each bag takes about 30 minutes to be infused into you. After that, you're going to stay at the treatment center for, on average, 3 to 6 weeks, where they're going to monitor you. They're going to make sure that there aren't any infections. They're going to make sure that the stem cells have grafted into your bone marrow, and that Lyfgenia has started to work. After that, they're going to identify that, determine that it's safe for you to go home. And of course, you're going to be followed up for every 6 months for a minimum of 15 years. That's the treatment journey in a nutshell. But again, I do want to say, like, this entire process from step 1 to 6 could take anywhere from 6 to 8 months. So it definitely is a journey. And it's one where, along the way, you're learning, and there's a lot of things to consider, in terms of all the steps that you need to do, preparing for the chemotherapy, maybe through fertility preservation, and also, making sure you've got a solid caregiver team in place. Any questions on this treatment journey?
I just had one quick question. I know that this was possibly talked about at the beginning. Just for those that don't know, stem cell, the term, or what it means, could you explain that really quickly?
Yeah, so stem cells, these are cells that are actually, your body makes, and they're made in the bone marrow. And this is what is utilized that gets altered, I should say, in the Lyfgenia creation process, to then be infused back in you, which is going to help your body start producing, in our case, producing new or different types of cells, which is really similar to, we're calling it a functional copy of hemoglobin A. Yeah, so I mean, if you think about it, it's your cells are really being kind of altered to help produce that functional copy of hemoglobin A. And I say, in our case, it's added because we are gene addition.
Thank you. Question for you. Is the Lyfgenia infusion duration different from the blood transfusions that people normally get? Or is it a longer process? Is it a longer duration when they're in the moment, or is it shorter? Do we know?
Are we talking about the Lyfgenia infusion piece?
Yeah, as soon as when I get into step 5 and they're doing that, is this longer than what blood transfusions? How long? Because I don't know how long blood transfusion last. So I was
Yeah,
wondering, are they around the same amount of time, same duration?
great question. Blood transfusions, I'm not sure the length of that. Some of you who've been through blood transfusions may know how long it takes, but what I can say is Lyfgenia, I can compare it to, like, my brother actually has cancer, and he goes every 2 weeks for chemotherapy. And when they put the bag up for him, it's like 1 hour, for that bag to get infused in him. What we know with Lyfgenia, it comes in bags. It takes about 30 minutes for each bag. So it all depends on whether you're going to have 1 bag or 4 bags. A patient that has 4 bags, then that's a 2-hour infusion process for them. For a patient that has 2 bags, it's 1 hour, and for 1 bag, it's 30 minutes. So it's 30 minutes per bag.
Thank you.
You're welcome. Any other questions on this treatment journey here? Ms. D.
Go ahead, Dino.
Yes, I'm sorry. Okay, it wouldn't be me if I didn't ask. So I just have to ask, like, with everything the process that you explain, it sounds, me personally, it sounds so painful. It sounds like you really have to put your body through a whole lot. Can can either one of these steps or going through this process cause a sickle cell patient to go into crisis just trying to get better?
So your question is, did anyone have a sickle cell crisis while going through the process? Uh,
Right. Like, especially with the conditioning chemotherapy.
that's a great question. I'm not quite sure the answer to that. I'd like to circle back with you on that, or circle back to the team here on this, because I'm just trying to think this through. That's a really great question. I'm not sure the answer, and I don't want to give you the wrong answer. And I'd like to be able to pull from whatever data we have on file. Did anybody experience a sickle cell crisis going through like the conditioning process or prior to the conditioning process? So let me get back to you on that one.
Okay, and also just to, while you looking for that information, could you also, is it possible to okay, well, were there some patients that had sickle cell that started the study and it became too much for them and they had to leave or they stopped? Do you all have that information
Yeah,
also?
there definitely were patients that happened where that happened, because if you recall, my earlier slide said there were 54 people who initiated um,
Right.
stem cell mobilization and collection. Um, and then by the time we got to the actual study, there were 45 that actually went through. So, what's that? Five. So
Yeah.
there's 9 people who, initially started, but somewhere along the line decided, opted out for a whole host of various reasons. Some decided, oh, not for me. I'm not going to go through with it. And that data is on file. Again, that would be something like specifically for me to say, patient number one, decided not to do it because of this. Patient number two had this or that. Like that's all data that's on file. And also, here's another thing I'm going to encourage you. Like in a minute, I'm going to share with you about our patient navigation team. That's a team that can really get a lot of these questions answered for you as well. I will definitely circle back with your group here, but our patient navigation team can definitely get you answers to these questions, and also connect you with a qualified treatment center transplanter who can also answer these questions, or provide you the answer to these questions, because they have more access to this data than we do. So
Okay, thank you. I appreciate it.
you're so welcome. Any other questions?
I had a question after Miss D said what she said.
Mm-hmm.
So how, so suppose you get to step 4,
Yeah.
or I mean, what when people have fallen out of the study or have decided to against it, where can you actually stop that process, or where did that actually happen? You know what I mean? I'm not certain if I'm saying that clearly, and if I'm not, I'll try to restate it again. Like, if there were complications moving through the process,
Mm-hmm.
what would be the step before you really, I mean, I'm not the last step, but what is the step where people can just back out? Because once you start the process, there's a point here somewhere where you can't, right?
Well, I'll say this. Remember,
Okay.
in step 2, they do collect backup stem cells, right? These are
Right.
the rescue cells. So if need be, anywhere along the line, let's say you get to, um, uh, the conditioning phase where,
Yes. Yes.
they're making room in your bone marrow with this chemotherapy for Lyfgenia. If some complication occurs, you're not going to move forward with Lyfgenia, they can always restore your backup stem cells.
Okay. Okay.
Um, and I imagine the same thing would be if any issue occurred in the recovery down the road where you're not going to graft, or
Mm.
things are happening there. But again, these are all great questions, and these are questions really for your healthcare provider that you would be evaluated with in terms of, are you a candidate, and what could happen in this
Okay.
process for me.
Okay.
But yeah, that's the first part of it. And then the other piece you were saying, like at what point, I think there's multiple exit routes along the
Oh,
way,
okay.
because
Okay.
things could happen, and that's because we've got the backups themselves, right? Um,
Absolutely. And
in the
flexibility is
trial,
key.
yeah, and in the trial, some of the people, well, I don't, you know what, that I'm not even going to say that.
Okay.
That some people may have backed out before in the pre-treatment phase, and some people may have backed out
Oh,
somewhere else along the line.
okay.
I don't have the data of when and where they backed out.
Okay.
And Ms.
No
D, I
worries.
see your hand up again. Did you have another question?
Yes, I did.
Yep.
Okay, I'm sorry. Are there
Nope.
any are there any stipulations or things that may get you disqualified from the study during this process? And are there any contraindications?
So we're going to talk about that in a second.
Oh, okay,
One
okay,
real
okay. I'm
quick.
sorry.
Well, hold on. I want to answer it real quick. Remember, right now, this is out of clinical trials. I'm sharing with you the clinical trial data, but
Ah,
there are people who are moved. It's approved. It's approved and on the market, and
okay.
there are people who've already gone through this process on the market. But to your point, Ms. D, one of the things, like, you can't, you were definitely evaluated thoroughly before this treatment. That's why, during that whole pre-treatment process, or even the pre-treatment process, it's really about evaluating you, making sure you don't have an alpha thal, a double alpha globin deletion, because that would disqualify you. Making sure you don't have HIV, that would disqualify you. Making sure you're not pregnant, that would disqualify you. And there's a whole host of other things. And that's where your healthcare provider is going to talk with you, and all the things that they're going to be looking for to determine if you're a candidate for this treatment. Did that
Okay.
help?
Yes, that helped a little bit. Yes, it did. Thank you so much.
All right, well, if you need more clarification or there's something I missed, please let me know. Don't hesitate.
And
Oh
just
no,
to make
you're
sure that
good.
I
This is
remember,
very informative. Thank you so much. This is very informative, and I am going to reach out to the patient team because I have so many questions, and I just think they will be helpful, in answering those. But you're doing amazing. This is very informative.
Oh,
Thank you.
thank you. And you know what? I'm going to transition to the next slide, because you just really queued this up. As much information as I'm providing here today, and you can see there's still gaps, there's going to be, this is a journey, this is a process, and it is not one you want to go into lightly. You're going to have questions today. You're going to sleep on this and have questions again tomorrow, next week. And you're going to want to know, who do I reach out to? Sheri was great, on Saturday, but I need to talk to somebody else. And that's where you get to our My Bluebird support, our patient navigators. So again, there are 3 folks on this team. It is not a call center. We have Keisha, we have Dana, we have Sarah. They are incredibly knowledgeable about sickle cell. They are incredibly knowledgeable about this journey. And when I say this journey, questions you might have about the process, questions you might have about where can I go to be evaluated? Where can I go that's going to take my insurance? Is my insurance going to cover this? What about fertility preservation resources? Are there resources out there for me, specifically related to my plan or my coverage or whatever? Are there transportation resources out there for me to get to and from the treatment center? Because the closest treatment center to me is, a couple 100 miles away or whatever. This is the team that can answer all those questions. And here's the thing, you can engage with this team without having to say, yes, this is what I'm doing. The time to engage with them is now, as you're like, I heard some information about this. I just want to be able to have a touch point of folks that I can talk to along the way. And you can connect with this team. So you do not have to be committed to gene therapy or our gene therapy to connect with them. Connect with them. That QR code in the top left hand will take you to the website of mybluebirdsupport.com. You can see there's a phone number there if you want to call them. And that's an 800 number. And then there's their email at mybluebirdsupport@bluebird.bio.com. Lastly, I'll say, and I'll take your question, is that if you go to mybluebirdsupport.com, at the top it says, click here to have a navigator, patient navigator contact you. It's a real simple form. You just put your name, your email, your phone number, and tell them, hey, I want you to send me an email. I want you to call me, and they'll call you. You don't even have to remember. They'll just reach out to you. And then again, you can stop or start that as whenever you like. All right, so that's a lot about my Bluebird support. What questions do we have? I see Miss Nadina has her hand up.
So I just wondered if I know you talked about your team, great team. Anybody on the team have sickle cell?
Yeah, great question. We do have a patient navigator, a patient educator who has sickle cell, and I can disclose this because she's open about it. And her name is Precious. So, and Precious is also a nurse practitioner who herself has treated sickle cell patients.
Fantastic, girlfriend. Thank you so much. That is wonderful. Great information because everybody, all the clients, want to know where the perspective is coming from, when you talk about the team. And the team, of course, are educational people that know what they're talking about. However, their experience, brings much more of a closer connection when you're talking to a client. And if they have sickle cell or a child, I mean, just some sort of association, even if they don't have the disease, actually, you know what I'm saying? It's just so that they know, I mean, they've actually seen it. They've experienced it. It's good. Okay. Thank you.
The other thing I want to share too is one of our patient navigators, Keisha Simmons. She too is a nurse practitioner who treated sickle cell in pediatrics herself in Ohio. So another person, not necessarily with lived experience of having sickle cell, but lived experience of treating sickle cell patients and seeing sickle cell.
Absolutely. Absolutely. Thank you.
So welcome. Any other questions at this point? Well, here, we're going to wrap up here, and then I know you guys have a survey, and then I'll open the floor because I'm sure there'll be other questions that are brewing. But lastly, some final important safety information. And I think Ms. D, this is going to answer some of the questions you have. Things you should avoid after receiving Lyfgenia are definitely donating blood, organs, tissues, or cells. And then possible side effects. So there are possible side effects of Lyfgenia on the day of the treatment, and they include low blood pressure and hot flush. We've talked about the possible side effect of, developing blood cancer. Another possible side effect is that after treatment, it could take a longer time for your platelets to recover, which means it could cause bleeding, but they're going to monitor you and manage that in the recovery phase at the treatment center. And of course, these aren't all the side effects of Lyfgenia. So if you do experience some, be sure to let your medical team know. And we also talked about the side effects with chemotherapy and some of the other therapies, medications you're receiving as a result of the treatment. Because of all of this, it's important to have, the regular checkups with your healthcare provider. We've talked about that in great detail. And, we talked about the importance of having patients enrolled in a post-marketing study to assess the long-term safety of Lyfgenia and the risk of blood cancer after the treatment. And then the last piece of information I want to share is that Lyfgenia uses a vector that's based on the blueprint of the HIV virus to deliver that genetic material to your cells. So you should know that you will not receive an HIV infection as a result of receiving Lyfgenia. However, if you are in need of an HIV test after receiving Lyfgenia, you just want to be sure to let your provider know not to give you a PCR-based test. And there are multiple other types of HIV tests that are out there that they can provide you, but you definitely want to just alert them with that. And your treatment center is going to give you a card and packet that'll help you, communicate that to them as well. So in conclusion, Lyfgenia is a one-time, it's transformational gene therapy. It does have the potential to decrease or stop vaso-occlusive events. And that QR code right there will take you also to lyfgenia.com, which is a very interactive website. A couple things I want to point out on that website is, all the data that I've shared here today and the information is there. So if you want to go back over this, because I know, again, this is dense and detailed. The website is incredibly interactive and goes into a lot of explanation. The other thing that's on that website that I just want to bring to your attention is the patient consideration brochure. That's an actual printed brochure that we give out when we do tabling events, or if we were with you in person. But you can download a copy, a digital version of that brochure right from that website. And in the back of that website, there's an appendix with a lot of definitions of a lot of the terms around gene therapy. But more importantly, there are 2 pages with questions, a set of questions for your healthcare provider and a set of questions once you get to the qualified treatment center. And it really does help you kind of start that conversation. Is gene therapy for me? How can I be evaluated? What does this mean? Just kind of prompting you to some questions. And just like today, as one person asked a question, it kind of prompted another question for another person. So that resource is really helpful as you're going to your healthcare provider to help, discern if this is for you. All right. Real quick, I see your hand, Ms. D. Do you all want to pause for your what was it? Your survey before we open the floor for questions?
Yeah, let's do that really quickly.
There was another question. So I'm pulling all of this out of the prescribing information booklet, and let me see if I can just transition my screen so you guys can see what I'm talking about here. So if you go to lyfgenia.com, like right now, that QR code will take you to lyfgenia.com. Let me see if I can pull it up. This is what you get when you go to lyfgenia.com. Okay, so right here where it says prescribing information, a lot of the answers to questions that you had may very well be here, with the exception of some of the ones that are pretty detailed. Now, I know this is very small. You can blow it up. Let's see. Wait a minute. But this is where, here we go. And by the way, a little piece of knowledge for you. Anytime you're taking a medication, every medication has one of these prescribing information packets, and they're all outlined the same. So you're going to get this table of contents right here with, the way it's organized. So for those of you that had questions about like adverse reactions, that's section 6.1. It's going to talk about the clinical trial. So let me just scroll down to that, because I think I just saw an answer to a question that came up earlier in this section. So right here, someone asked, did folks have sickle cell crises at any time, after during the process of the treatment and so forth? So looking here, this is a list of table of adverse reactions. Sickle cell anemia with crisis, there were 7 patients, which was 16%. And that is saying this footnote here is saying that it includes events prior to month 6 of non-adjudicated occurrences. So really prior to month 6 of after receiving the treatment, 7 patients had some form of a sickle cell crisis. However, now that I think about it, the question was actually more specifically, did anyone experience a sickle cell crisis while going through the process? I'm not sure if that's in here. This is more showing you the adverse reactions that occurred following the treatment with Lyfgenia. But there are a host of, if you know, and I know it can be challenging to comb through this, but there's a host of detailed information about the treatment in the prescribing information packet here. So again, you can access this right on Lyfgenia.com. And this is what it looks like when you get to Lyfgenia.com. And by the way, I want to encourage all of you, when you go to Lyfgenia.com, this brochure here, like if you scroll down from the first page, and it says Explore Our Consideration brochure. If you were to click that, it's going to download the brochure. I actually have one downloaded. And when you download it, here it comes. This is the actual, like I said, we have printed copies of these, but you can get one digitally here. And I'm just going to scroll back to the top of the brochure. But this is what the cover of the brochure looks like. And then there's all these little tabs along the side, oops, on the left-hand side. It's like, what is Lyfgenia? A lot of the same stuff that I went over in the presentation. Why Lyfgenia? It talks about the vectors in more detail. The steps of the treatment journey, here they are. They're listed there. So a lot of great questions, or a lot of great information that we reviewed. There's a lot of important safety information that we reviewed as well. There's the clinical data. So, you know, again, I just wanted to bring this to everyone's attention and hopefully, you know, help answer some of the questions we had. And I'll put the QR code back up. And Torres, are we ready to move forward and answer questions?
Yes, I was just waiting for you to finish that great information you just gave us. Okay, everybody, we should be done with the surveys, and now we'll start the Q&A at this point, and we'll start with Daenerys. You can go ahead and unmute yourself and ask your question.
Thank you. I just had a question about the slide that you put up before the last slide in the general information. It said that it was a vector of the HIV virus. What exactly does that mean? What does it mean it uses a vector? What is a vector?
Let me get to another. All right, actually. So here, I'll go back to this one. So a vector, this slide really breaks it all down. It's a vehicle. It's designed to deliver the genetic material directly to your cells. So remember, with Lyfgenia, it's gene addition. We're taking your cells, we're modifying them in a lab, and then we're going to deliver those cells right back to you. So those genetic cells are coming right back into you. But the way in which we bring it back into your body, it comes into your body through a viral vector. So that's all going to be, you know, part of the manufacturing process with Lyfgenia. Viral vectors, there's two types. There's viral and non-virals. They use viral vectors because they're really efficient at getting that genetic material to the cells of the body. So the most common viral vector is the lentiviral vector. And just so you know, it's one that's been studied for over 20 years. And the lentiviral vector is definitely the most well-studied one, but it is one that's based on a blueprint of the HIV virus. So if you think about this what's on the screen, this image on the screen being a vector, right? And it's kind of set up, it's exactly set up, designed based on the HIV virus. But they've taken out anything within that vector that could potentially give you HIV. So it's not possible for you to get HIV. We're just using the model of it. So as it says there, you know, Lyfgenia can't cause HIV because the HIV virus responsible for causing the infection has been removed. So another way to think about it is a vector is like an envelope that's used to deliver the genetic materials to your stem cells, right? So if you take this envelope and you take out the HIV instructions, and then you put in the instructions in the envelope to add what we call the beta globin gene, And the beta globin gene is really that working or functional copies of the gene that's going to have your body producing a working copy of a hemoglobin A. And that working copy of hemoglobin A is in turn going to decrease or stop vaso-occlusive events. So we're putting that beta globin gene into that envelope. That envelope's the vector. And then we're sending that envelope, if you will, in the mail right to your blood stem cells. So that's one of the analogies that they've used to kind of review blood stem cell. To review vectors. Did that help?
Yeah, so it kind of you all just use it kind of to infect the body as if HIV would infect the body, but it's the actual gene therapy, right?
Right. So if you think
Okay.
about viruses like HIV, they're multiplying. Like it's even like the common cold, right, or the flu. It's a virus. It multiplies, and the more it multiplies, the sicker you get, right? So what that says is that virus, that vector that virus is using to help multiply those cells, it's very effective at spreading that disease or that condition. In this case, it was I mentioned the flu. So, or if it's HIV, it would be HIV. That's why they use vectors, because they want to be able to get these working copies of beta globin genes into your stem cells and having them multiply and as quickly and as fast as possible. And the best way to do that is with a viral vector. And like I said, it's the HIV viral vector that they use because it's been most studied.
Okay, it makes sense. Thank you.
You got it. And I should say, again, lots of gene therapies out there, lots of gene therapies coming, and a lot of them are using viral vectors, and they use a lot of them use the lentiviral vector. There's another called, I think it's the AAV, adenoviral vector, that's another type of vector that's been being used as well in different types of gene therapies. But for our gene therapy, it is the lentiviral vector.
And Sheri, you said it was approved, correct?
Oh yes.
Yes.
We're on the market.
Yes.
It was approved December 8th, 2023.
Okay. So how many clients have participated?
Yeah.
Yes.
So I want to say we collected, I think, 17 last quarter. It was either through the end of last year. We've got, like, I want to say, don't quote me on these numbers, but somewhere between 40 and 50 that are in the process of being collected or scheduled to be collected.
Wow. Okay.
Because remember, it's a process.
Absolutely. Yeah. Months. Yeah. I get it. I'm just wondering because I know, like, that's why I started out with, it's been approved, it's out there, right? So what are your numbers looking like? But it is an extensive process. So you're going to have much more data to collect between, moving forward is all.
Oh yeah, there's already some data that I know was presented at SCDAA back in October. We have 60-month data now.
Oh, good show. Okay. All
So,
right.
and I anticipate later this year, maybe there'll even be more data that's coming. So data is always coming.
Absolutely, because it is what it is and it's important. And without it, you can't even move forward, right? So
Right.
it's a necessary factor. But I just want to thank you, Sheri, because I made this call, but I'm going to have to remake this call because I was late with the client. But I just want to thank you, and I want to thank everybody that joined us today. And I'm going to leave Kimball to close you all out. Okay?
Great.
Thank
Pleasure
you.
meeting you. Take
Yeah.
care.
Uh-huh.
Thanks for having us.
Okay, everyone. If you still have more questions, we'll go about 10 more minutes with the questions, and then I will shut us. Although I'm not directly the host right now, but Y'all can leave after that. Once again, Sheri, thank you for your time and knowledge. Appreciate you so much. And again, there's no such thing as a stupid question, so please feel free to ask questions. The only way we learn is by actually being involved and asking questions. So go ahead and ask whatever you feel like, even as insignificant as you think it may be, it might be life altering for somebody else. I learned that a lot throughout my life and recently, that no question is too small. So please feel free. We'll take about 6 more minutes. We'll be ending at 12:40. So
I'm sorry to break in, Kimball. So you don't have, you can't close this out or because I'm recording, or because I'm looking down here to.
Did you make me the host? If you make me the host.
Well, Antoine was the host. I'm looking at host tools, and he was the host initially. So I don't really know.
And I think he made me the host. Let me see if I can. I've been looking to try and figure out where I could change the host.
Yeah, and that's what I'm looking at now. And I got this whole.
If you're the host, Sheri, then as soon as we're done, you could just end the meeting for everybody once we're done. So
yeah,
yeah.
Actually, I'm sorry, because you guys were already on. I didn't start it. So there you go. Goodbye.
Okay, goodbye, Nadine. Have a good day.
Sorry.
I'm gonna put my screen back up, and I'll go back to the one with the. Go back to the QR code for Lyfgenia.com. And by the way, at that site too, there is a link there to go to my Bluebird support. I do want to just stress one more time, and while I'm doing that, I'll put their link back up. My Bluebird support, this is our patient navigation team. There's the QR code to access them. Any questions that you might have, because I don't want you to feel like you're under pressure right now, 5 minutes left. You know, believe me, questions are going to come up later today, next week, next month. Please connect with our patient navigation team. These are the folks that can really help you navigate, and there is no obligation. You can just call them and say, hey, I saw a presentation and I have another question. And just stay connected with them. You can call them as many times as you want, reach out as many times as you want, but more importantly, if you could even just get yourself registered or connect with them by going to our, let me see here, I'm gonna pull it up for you here in a second. If you go to their site,
so I did have a question that just popped into my head, Sheri, just off the cuff. How difficult is it to manipulate stem cells because of their nature of being so not volatile, but you know, they change pretty quickly, and if one little mistake could go wrong, they're all of a sudden not necessarily the cell that you're looking for, right? Because they can change so rapidly, and once they're locked in place, correct?
So if I'm understanding your question correctly, you may be asking like how difficult it is to collect stem cells or get stem cells from your body and into a collection. So first step, when we talk about stem cell collection process, which is I think step 2, they give you a product called Plexifor that really moves the stem cells, mobilizes your stem cells and moves them from your bone marrow into your bloodstream. And so that makes it easier for them to collect it, right? That's the process. I mean, years ago, we talked about doing, you know, if somebody was getting a stem cell transplant or whatever have you, you were going into like a spinal tap in the back.
Right.
And it was pretty invasive, but
right.
they've figured out how to do it this way now, which is very much less invasive.
Gotcha.
The second part of your question about, you know, how viable are they? So what I can say is, and I hope I'm answering this right, if not, again, reach out to my Bluebird support, or even your healthcare provider. But what also happens in that process is they have to collect a certain number of cells. And I want to say it's 34 million cells that need to be collected in order to make dose. In other words, in order for them to be able to, I'm sorry, it's not 34 million. 16 target minimum collection is 16.5 million cells that they need to collect to make dose. That's the minimum. And so part of that process, once they collect it, is they're looking to make sure that are the stem cells viable? Are they, did you make dose? Meaning, did we collect enough of viable stem cells? So all of that's going to be evaluated once your stem cells are collected and the material and it's sent to the lab. So there is a process where they are assessing all of that throughout, and will make certain that they've collected enough and collected the right quality of cells. The other thing is, when I talked about the pre-treatment, patients will have to go through a couple months of transfusion to get their hemoglobin up in the, I think it's 9 to 12 range, I believe is what it is. I'm sorry, 8 to 12. The target hemoglobin range is 8 to 12. I'm sorry, 8 to 10, not to exceed 12. And that is what's going to, in turn, help with the quality of the stem cells.
That makes sense. Gotcha. And then if they're determined that their stem cells are not a viable option, is there ways to maybe make your cells more robust in order to be viable at that point? Or let's say like they do the collection and it doesn't reach the 16.5, is there something else that they could do to bring that number up, or are they just not a viable candidate?
No. Some people they collect all the cells they need within one collection. Some people, they may need to come back for a second collection. There needs to be a 14-day window between those collection periods.
Gotcha.
So, all that's going to be assessed. I mean, I think, don't quote me, but I think there are people who they're what they call poor mobilizers, where for whatever reason, even in spite of Plexifor and administration and the conditioning or the transfusions, that they just are not, they're poor mobilizers, and then that might indicate you're not a great candidate. But I mean, that isn't something that happens often. It's just something that can happen. And again, this is where your treatment center and all will be working with you along the process, as well as Bluebird Bio's back-end team is going to be working with the treatment center on that as well.
Perfect. Thank you. That was a great answer. Appreciate that.
So what I have on the screen here, this is my Bluebird support. When you get here, I went to mybluebirdsupport.com. This third tab over that says request a call. Please go there, click that, and it's a very short form where you're going to put in your name, your preferred method of communication, phone or email, and then of course select the condition. In this case, it'll be sickle cell. And I assume it's going to give you another page where you're going to put in your email or phone number. But and you submit it, and they're going to either call you or email you, whichever method you selected, and reach out to you to answer questions, at a time that's convenient for you. That's if you don't have the time to reach out and call the 800 number at any time, which there it is, right there also on my Bluebird support, 1-833-888-6378. And you can send them an email as well. But I really do encourage you, like if you have any further questions that we didn't answer today or questions come up, reach out to this team. They're really there to support you throughout the entire process of the journey.
Awesome. Thank you very much, Sheri. Thank you very much, everybody, for your time and your attendance. It is time once again to say goodbye. Appreciate all your time. And
One second.
Hold
on 1 second, Kimball. Yeah. I saw a question in the chat.
Oh, okay.
Is Stanford currently doing this? That's a great question.
Oh, yes.
So let me take you back to Lyfgenia.com. Because if you go to lyfgenia.com, you'll be able to see there's what we call a QTC. Here it is, Find a Qualified Treatment Center. When you click that there, you're going to be able to put in, a zip code, a city, or state, and this little map comes up. So let me see, because I'm in the East, let me get clear on who is doing it in your area. Let me see who comes up. Oh, this is one thing I don't like about this. It doesn't, let me just do it this way. So if we put in California, but okay, Children's Hospital Los Angeles, UCLA, Loma Linda is activated. Did I miss anything? And City of Hope National Medical Center. So these are all sites that are activated. But oh, here we go. Lucille Salter Packard Children's Hospital at Stanford. So it looks like they're activated for pediatrics. But again, any further questions on these sites and who's coming? There's more coming, that's for sure. But again, My Bluebird support would be the next great place to reach out, and they can help you navigate that as well.
Awesome. Great last minute question. Any other questions?
Thank you, Miss Sheri.
No, thank you all. I appreciate you all so much. Best of luck, and don't hesitate to reach out to our team for any questions or anything else.
Again, the only way we can make change is by being the change ourselves, and we definitely got to get off our butts and do something about that. So I'm all about that. So let me know. I'm always ready to go. Thank you. Appreciate your time. Keep smiling. Stay happy. Stay healthy. And I'll see y'all later. Bye.